Did you know that the way you carry your baby can affect your recovery after childbirth? Stay tuned and I'm going to share with you exactly how you should carry your baby as they get older and heavier. Hi, my name is Lynn Schulte. I'm a women's health physical therapist at Intuitive Hands Physical Therapy in Boulder and Denver, Colorado, and I am your birth recovery expert. And today I want to talk to you about how you're carrying your babies. So it's not as challenging when they're tiny little ones, right? We tend to just hold them in the front like this. And that's great as long as they're tiny and you're able to maintain good posture in your trunk as you're carrying your babe. The problem is that when we're carrying babes for a long period of time, we tend to have our trunk help out. We tend to have our bellies kind of help out and let the weight of the baby relax into our trunk so our arms don't have to do as much work. And over time, if we're constantly in this posture, that's going to do a lot of effect to the pelvic organs in our pelvis and healing a diastasis in our belly. So if you have a separation of your abdominal muscles or your pelvic organs are not in their proper supported place, constantly carrying your baby and having it rest on your belly is going to cause greater problems with those two issues. So what we want to make sure is that we maintain and keep our pelvis and our ribs stacked on top of each other and that we're not thrusting one out over the other as we try to carry our baby. Then what else happens is that as the baby gets bigger and gets more support and we start hanging on to them on our sides, I'm going to use my bigger doggy here to represent this. What we then tend to do is thrust out our hip to try to let the baby hang out on our hip. And if we have a separation of our abdominal muscles and we tend to carry the baby only on one side, what ends up happening is these trunk muscles get short here and they get tight and they will pull that rectus muscle away and not allow this to heal in the midline. So if you're dealing with diastasis, you really want to be careful with how you are carrying your baby. It's fine to carry them on this side, but keep your hip in line with your shoulders and don't thrust it out and have your body carry the weight of the baby. You need to make sure that your arms are doing more of the work. So, and also switch it up. Make sure that you carry your baby evenly on both sides so that the muscles don't always get tight on one side. I've seen this over and over in my clients. They'll come in this whole area in here, and even in the back on this side will be all tight. If they're constantly carrying their babe on this side, this all gets tight, the back muscles get tight, and then it pulls that abdominal muscle so that these guys stay apart and can't heal. So super important to switch sides and make your arms do the work and not rely on your body to support your baby, but make your arms do it. And that also goes with the slings. If you're using a baby carrier, let the carrier do its job. What I find a lot of times is as the baby's in the carrier, we're still doing this. So we're thrusting our hips forward and letting the baby rest on our belly versus keeping our hips over our shoulders and allowing the weight of the sling to support us. So if you're using a baby carrier, let the baby carrier do its job and keep your alignment, your hips and shoulders stacked on top of each other as you're carrying your baby. Now, if you're using those slings that come over one shoulder, please switch it up. Go to the different shoulders. Don't always just use it over one shoulder because then your muscles get tight in a certain pattern. You want to switch it up. So make sure that you're using your body in a more balanced way as you're carrying your baby. It's important to, I know if you're right-handed, you tend to keep the baby on the left so you can do things with your right. But when you're not doing things with your right, get your baby over on the right and change it up for your body, okay? So important to mix it up, but keep your body balanced and also keep your shoulders and your hips aligned. And don't let your baby rest on your belly, okay? Good luck with that, guys. Take care.